Hey everybody, Ben Hallbeck here on a cold day in December in the midst of the COVID pandemic. Miss seeing y'all's faces. It's been a strange year, has it not? We are going to go over insurance, and don't get worried. There's 46 pages in this presentation, but we're only going to focus on a couple, three or four. Big picture, little picture. Big picture, this year we kept everything the same. We kept the same carrier. We kept the same plans. All of the rates stayed the same except for medical changed just a little bit. And that's because we paid out more in claims than Humana collected in premium. However, we discussed our options and the partnership group decided to remain with Humana. I feel like that's a pretty good decision because they've been a good carrier for us over time. That's evaluated every year. But this presentation is going to walk us through pretty quickly. A lot of the things that we already know. So there are going to be times in the presentation where you're going to close your eyes because I'm going to be moving pretty fast. So medical, the Aflac plans, dental, vision, life insurance, all of this is COBRA eligible. This is just a friendly public service announcement. These bullet points are qualified life events, QLE, qualified life events. These mean that you can go to Kim and change your election at any point in time, but you have to have one of these bullet points going on in your life. Normally what you pick during open enrollment sticks for a year unless one of these qualifying life events happens. Carrier is still Humana. The network is what I'm highlighting right here, National POS Open Access. That has not changed. Plan is the same as it was last year. Those preventative services, physicals, mammograms, pap smears, all covered at 100% or $0 to you. Primary care and specialist is $30 and $55 copays. Retail clinics, $30 copay. Doctor on demand. Now, Humana has a deal running right now, and I'm going to reference some notes that were taken to make sure that I don't get it wrong. Humana's got a deal going right now on virtual visits because obviously it's really important. And so doctor on demand is $0, not $30 as stated in the guide. But here's the thing. 2021 is a whole year, and Humana has only said that they're going to do $0 copays or free copays for virtual visits or doctor on demand through March 31st, 2021. And so, you know, we don't know what's going to happen after that. It very well could continue. It very well could change. So we put 30 in the guide, but just know that it's $0 right now. The deductible is $2,000. And once you meet the $2,000, if you're in a hospital setting, you're done, because the number that I'm highlighting right here, that $2,000 is your maximum liability. So your maximum liability equals your deductible. So in other words, once you meet your deductible, you're done, which is really, really good. So you might have some other copays for things like that, but if you've got a $100,000 surgery, then you'll be on the hook for the first $2,000, and that's assuming in-network and covered services. So no changes there. The scripts are the same, 10, 40, 70, and for the most expensive medications, which nobody really ever gets to, it's possible, of course, but very unlikely. It's 25% copay, and again, that plan design didn't change at all. Now, this is a squirrely, but I like it issue. If I were writing that in an email, it would have been hyphenated. Here's the deal. A lot of drug companies have a mandatory generic policy. So that means if there's a generic and a name brand available and you choose the name brand over the generic, then you pay the difference between the generic and the name brand. This particular policy, which is why we have it kind of bolded and highlighted here in orange, dispenses written, DAW. If your doctor says, you know what, Ben is taking XYZ medication, there is both a generic and a name brand available for it, but dispenses written, meaning get the name brand, then you're not going to have to pay the delta or the difference between the name brand and the generic. So just remember, if you're having an issue with that, that's been in the policy in the past, but just have your doctor write DAW or dispense as written. A lot of y'all are really active and competitive. I will say on Go 365, that renews on February 1st. Michelle in our office is going to be in communication with Kim and with Marcy about how to roll out some new stuff in the new year, just as a reminder. It's the same program. We want you to get your stuff. And I know you're all probably wondering, Ben, what did you just get with your Go 365 bucks? Well, I'm really glad you asked this. Thanks for thinking about it. I bought some hats that have Bigfoot on them, Sasquatch. So I bought some Sasquatch hats on Amazon. They're awesome. I went deep in the interweb hole to find hats with Sasquatch on them. But if you can't find it on Amazon, you know, it probably doesn't exist. You can buy all sorts of stuff with your points from Go 365. This is our second public service announcement. Call 911 was new in like 1970. So, you know, just wanted to remind you of that. The biggest thing that we like to remind people on this page, there's a big old difference between urgent care, freestanding ER, and a hospital emergency room. So a freestanding emergency room is the same thing, same bill, same treatment as an emergency room contained inside a hospital setting. The part that is confusing is that developers are putting urgent care in the same building as a freestanding emergency room. And if you're not paying attention, you're walking through door number 1 and you should be walking through door number 2. And so just be very aware that unless it is life or limb threatening, then you would want to stay out of the ER anyways, because they're just going to stick you in a chair. So just make sure that if you're going to an urgent care provider, it is actually an urgent care provider. This is the app, Doctor on Demand. If you have not downloaded it, please do. And here's some more information about mail order for Humana's pharmacy. Really great for maintenance medication, 90-day supply, just shipped right to your door. Some instructions on what to do to find certain things in the Humana app. So you can check out right here where you are on your medical, dental, or RX. That's pretty cool. It's all in one spot. You can see on this sample over here, it'll finalize how much the insurance paid versus how much you owe. So that's just helpful to see as the claims come through, especially when a question arises. You can look for a provider, find a doctor, find a hospital, refill your right source order. This is pretty cool. That's a prescription. So you'll go to select the bars, pharmacy, right source order refill. You'll follow these prompts and it'll look like this on the right-hand side, review and click submit. And then it'll come right to you. Look at that. Pretty cool. You can also look around for different prices on different drugs. There's also outside of Humana, an app called GoodRx, GOOD-RX, GoodRx, that is a discount finder. So I like to take a look at it. It's not going through GoodRx is just finding coupons and discounts. It's not running anything through your insurance. And so sometimes you might be able to find it cheaper. So just check it and check the Humana version of GoodRx right here. Go 365. We'll be communicating more information on that. Again, the program hasn't changed at all. You still get points for education, fitness, prevention, or healthy living in all different kinds of amounts. And we just love how active and competitive that y'all are. Okay. We have, honestly, a majority of the real estate in this guide is taken up by the duck. I have a policy like one of these. You've got a couple of them. And so I'm going to, just for the purpose of brevity, I'm going to explain this page and we're going to gloss over all of the detail. Now, if you have questions, please call our office or call Roman at Aflac. Because a lot of times those questions are like, I was diagnosed with XYZ, would the policy pay if? And so there are sometimes a lot of personal questions, which is great, but just way too many scenarios to be able to cover all the waterfront on a short webinar like we have today. So we're going to stick to this page. Here's the deal. You've got an accident policy. The bigger the accident, the bigger the payout. Money goes to your mailbox. That's the way to think about it. Short-term disability, insurance on your paycheck. It's for a preset number of weeks. All of this is in the policy language in this presentation, and happy to explain it. If you get sick or hurt, can't go back to work, it insures a percentage of your paycheck. So basically, you're insuring a portion of your paycheck should you get sick or hurt. That's what short-term disability insurance does. Cancer care, God forbid you should receive this diagnosis. It's paid in a lump sum benefit straight to your mailbox. Hospital confinement kind of sounds like you're going to jail, but you're not. You're just locked up in a hospital overnight. So this policy would pay money to your mailbox, depending on the number of days that you are in the hospital. It provides a daily benefit. And so basically you're just insuring against the risk of going into the hospital. And so it's kind of interesting to think about. If you do go into the hospital, you've got a $2,000 deductible. So you may find value in buying a policy like a hospital confinement that would send money to your mailbox in the event you have to meet that deductible and pay it to doctors and hospitals. You've also got an AFLAC critical care protection. So these would be diagnoses or sicknesses or illnesses that would be outside of cancer. So for example, heart attack, stroke are probably the biggest ones. If you have a family history of those, then this policy may be valuable to you. But these are outside of cancer. And so you've got all the rates here. Those didn't change. Here's the accident, short-term disability. There's the cancer care. There's the critical care. That is the heart attack, stroke, the non-cancer. Here's your hospital confinement. And then you've got a bunch of literature that you can read at your own pace. If you can read it while I'm scrolling through it, you are probably a genius, and you might not need to be working anymore. Actually, if you can read that fast, that would be pretty impressive. All right, we're going to talk about your teeth, your eyes, and your life, and then we'll be done. Carrier stayed the same. Pricing stayed the same. Plan design stayed the same. So Humana, PPO, you've got a $50 deductible, super low. Annual max of $1,500. That's a bucket of money that Humana's throwing at your mouth. So your preventative services that I'm highlighting right here, 0%. That's a freebie to you. That's covered. Scroll down too early. That preventative service is covered at 100%. So those are your teeth cleanings, x-rays associated with that twice a year. No cost there, but if you go in and you have services that would be in addition to or on top of, then you've got $1,500 that Humana is going to spend. So if you've got a cavity, that would be a basic service. If you've got a crown or bridge, that would be a major service. When you see these percentages, that just means that's the split between you and Humana. You're going to pay 20%. So if you've got a $1,000 bill for a crown, you're paying $500 of that. Humana's paying $500 of that, and the $500 that Humana just paid posts against this $1,500. That's how it works. Ortho, Lord have mercy. I wish ortho only costs $1,500. I've got 3 kids, and 2 of them, when they're smiling at me, I know they're going to need braces, and it is not $1,500. So consider this something is better than nothing. How about that? So you take advantage of it if you need it, but it's not gonna cover everything. You do have a little bit of a waiting period. You would have had to have been in the policy for a year until you can use that benefit. Humana Insight Network, or the IMED network. That's the network on all insurance. Just remember, the wrong question is, do you take my insurance? The right question is, are you inside of my network? And so this is the network. So you're going to go in, you can pay $10, and then you've got a decision to make. Do you want to get some cool guy glasses or cool girl glasses? They'll spot you $130 and then 20% off above that. Then you got lenses on a copay. Unless your lenses like mine are so thick that you have to shrink them down, that is not going to be a copay cost. I have a policy that looks almost exactly like this one, and I choose to self-pay above that $15 copay because I take my glasses and I go down like that just so they can fit on my face. So again, the choice you made, you go and you pay your $10 and you've got frames and the lenses that go inside the frames, or you've got contact lenses at $130. They'll spot you 130 and then give you 15% off above that. And that's what this once every means. You can't get glasses and contacts at the same exact time. That's not a new feature. My vision policy works the same way, and y'all's has in the past as well. Life insurance, cool thing is it's free. Gotta love that. The not cool thing is you're no longer living to access the benefit. So if, God forbid, that happens, we want the money to be routed somewhere. So that's what a beneficiary is. That's who receives the proceeds of the life insurance. Can be anybody you want. If you have children and you put your children as a beneficiary, that's tough to say at this time of day, on your basic life form, and you pass away, the money is held in trust until they get to 18. So my 11-year-old daughter, if she got the proceeds of my life insurance policy, would buy turtles and fish and all sorts of exotic animals, and that probably wouldn't be a good thing. So you can split it up between kids. You can give it to your child with the most promise and then give nothing to anybody else. So that's also possible. You can slice it and dice it however you want. EAP is free to you, paid by Hoblet, Darling, Rawls, Hernandez, and Hudlow. We're going to go over a couple of bullet points about what all that means. But here's the basic summary. I like to look at the flyer. It's a little more user-friendly, so we'll get there. Premium-only plan just means the money that is paid for, that is used to pay for these benefits, is not subject to taxation. So that's pretty cool. Costs. Before we get to that stuff on the EAP, we'd like to tell you how much this stuff is. Here's the total monthly premium. Here's the firm's contribution. And then here's the net effect to you. That's on medical, and that's per paycheck, semi-monthly. Dental, impact is there. Vision, impact is here. Dental and vision did not have any rate action. This is the EAP. This is what the EAP can help with. How about that? Talk to an attorney. Y'all are probably way better. You know, you might just want to talk to yourselves, but you know, it's in there. It's in there. How about that? Anything family, marital, or relational is under the purview of that EAP for referral and counseling services. And the rest of this information, y'all, is great late night reading material. I'm going to scroll over quickly. We're not going to cover for the sake of time, and then we're going to end right on this page. So coverage starts January 1st, just as it has in the past. There is an enrollment form. It's going to have a bunch of boxes on it. You're going to check boxes of things that you want, or you're going to check decline. If you don't want, you will put it's open enrollment. So check that box. That'll be in the top left of the form. Then you'll turn it into Kim. She'll remit it back to us, who will send it to Humana. And then we'll be ready to go. So if you have any questions, contact either myself, my name's Ben, or Erica. Erica is y'all's dedicated account manager. She's fabulous. Works real closely with Kim. And so please let us know if there are any questions. Bummed about not being able to see all of y'all in the midst of this. Hope you have an absolutely fabulous holiday season. And obviously stay safe and full of courage. All right. See y'all later. Bye-bye.